All right, so we're going to go ahead and get started. My name is Marina Riker, and I'm a reporter at the San Antonio Express News. I just want to let y'all know that we're going to be recording this meeting. We're going to keep you on mute, but you're more than welcome to submit questions through the chat that we'll try to get to later. And I just want to thank our host, Chris Coffey. He's with Molina Healthcare of Texas, and he's their plan president. So Chris, I'm going to go ahead and turn it over to you.
Great. Well, thank you. And good morning, everyone. Welcome to all of our guests, and thank you for attending today's important discussion on maternal care in Texas. This topic is timely for a number of reasons, those reasons being Texas's high maternal mortality rate, the lasting impacts of this pandemic, the need for access to care, and the importance of connecting underserved populations to a wide array of women's health services. Before we get started, I'd like to introduce Representative Ina Minjarez, State Representative for District 124 in Bexar County and Vice Chair of the Strategic Fiscal Revenue and Federal Relief Funds Committee. Thank you, Representative Minjarez, for joining us.
Thank you for having me, Chris. Good morning, everyone.
Thank you. And as an attorney, Representative Minjarez has fought for Texas's families throughout her career. She has won a special election for her seat in 2015 with only a month left in the legislative session. Representative Minjarez committed to using her time in office to continue fighting for women and children across Texas. By the end of her first full session, she was named Texas Monthly's Rookie of the Year for her methodical approach and substantive amendments she proposed. As part of her legislative career, Representative Minjarez has successfully helped pass legislation that has shaped foster care reform in Texas, as well as laws that have enhanced direct access to healthcare services and family and child welfare initiatives. Her legislative career has also been marked by her dedication to improving our public education, fighting the opioid and substance abuse crisis, pushing for more cybersecurity infrastructure, and supporting military families. So thanks again, Representative, for joining us.
Thank you so much for having me this morning. I'm honored to be here with all of you, especially this esteemed panel of frontline experts to discuss maternal health care. This is an important issue, not just for women and mothers, but also for our entire state. How can we prosper as a whole when Texas families continue to be at risk? Here in Texas, we pride ourselves in being prosperous and fast growing. And while in some areas that may be true, we have turned a blind eye to ensure the healthy and safe prosperity of our children and families. Texas has the highest rate of uninsured women of reproductive age in this country. Disparities are most pronounced in border counties where the rate of uninsured women is nearly 30%, and in Black women who account for 11% of live births, but 31% of maternal deaths. While we have made strides in the last few legislative sessions to bring awareness to these alarming statistics, we still have much to accomplish to ensure that no mother or child dies needlessly in our state. My colleague, Representative Toni Rose, has championed legislation for years, advocating for maternal health. This session, she successfully passed House Bill 133, which became effective on the 1st of this month. House Bill 133 increases eligibility for Medicaid for pregnant women from 60 days postpartum to 6 months postpartum. While this is a massive win for postpartum care, especially when you consider that the State Maternal Mortality and Morbidity Review Committee found that out of pregnancy-related deaths in Texas in 2013, about a third occurred 43 days to a year after the end of pregnancy. I was proud to work with my colleagues in the House to advocate for the passage of this bill as written initially, allowing for 12 months of postpartum care, and served as a co-author on the bill as passed. While the 6 months negotiated by the Texas Senate is better than the status quo, many new mothers will still be deprived of quality health care at a time when they are most vulnerable. I am confident that we will go into the 88th legislative session ready to fight for the full 12 months of coverage for postpartum care. While the Texas legislature has made progress on postpartum coverage, We must also improve coverage and care on the front end of pregnancy and maternal care. Women in Texas have the latest entry to prenatal care and the worst record of first-time trimester care in the country. According to the CDC, about 21% of women in Texas don't see a doctor or midwife until their second trimester. Another 1 in 10 doesn't start until the third trimester or receive any pregnancy care at all. Whether you are on Medicaid or private insurance, these systems are designed to be bureaucratic and confusing and are often inaccessible to those without prior knowledge or experience. It can take months to be seen by a regular provider and even longer to access specialists, which poses a great danger for high-risk mothers-to-be. We have a lot of work ahead of us. I stand ready to listen and learn from our panelists and participants today, work with each of you ahead of the next legislative session, and ultimately move the needle on this dire need of Texas mothers. With that, I'll turn it back to Marina and Chris to introduce today's panel.
Thank you so much, Representative. We really appreciate you being here. And Chris, I'm going to go ahead and turn it back to you so you can talk a little bit more about what Molina has done over the last year.
Great, thank you, Marina. And allow me once again to welcome all our attendees. I know we have more joining as we speak. And thank you again, Representative Minjarez, for your opening remarks. And obviously, thank you certainly to all of our panelists for participating in Molina Healthcare's panel. I thought I would take just a minute to provide an overview of my role as a plan president of Molina Healthcare of Texas, a role that I just took about 6 weeks ago, having relocated here to the Texas market, as well as also outlining our commitment to maternal health here in Texas. So I consider myself an official Texan now, as I've learned that the X in Bexar is silent, and it is indeed Bexar County. So I'm glad to now officially be a Texan. I'm also very humbled to serve as the new plan president for Molina Healthcare of Texas. And we strive every day to help build and maintain the culture of our organization to best serve our populations across this great state. With over 700 employees scattered across the state, we are well prepared to continue meeting the needs of our members. Molina is committed to helping moms achieve a full-term birth and to improve overall health outcomes of women in the communities we serve. And we partner with best-in-class providers to ensure women have access to quality healthcare close to home. Molina Healthcare of Texas recognizes and approaches delivery of care with the understanding that social determinants of health, including housing, economic stability, education, food security, and physical environment, are important factors to improving health outcomes. As a result, we offered lift services for pregnant women who needed assistance with last-minute OB visits. We partner with Prospera, a housing organization in San Antonio, to offer housing navigation services for our members in need of housing. And through our partnership with Prospera, our members also receive access to GED classes, after-school care, parenting classes, amongst other things. So we at Molina focus on improving health equity, access to information, and reducing health disparities, including but limited to race, geography, poverty, and education. So it's the focus of this plan. The focus of this panel was specifically chosen as Texas is facing maternal health crisis with a high maternal mortality rate and disparate access to care, particularly across minority populations. A lot of great work has been done across San Antonio and across the state over the past year. And the hope is that this panel lays out a little bit more about where we've been and, more importantly, where it is that we're going, with a focus on how various sectors from healthcare to government and community-based organizations work together to support maternal health in Texas. So thank you.
Thank you so much, Chris. And thank you so much for bringing us all together. I'm going to go ahead and get started and introduce our panelists. Natasha Bridges is the Senior Director under the Family and Children's Division of Catholic Charities of San Antonio. Kori Eberle is the Project Director for San Antonio Metro Health's Healthy Start program. Ashley Green is a registered nurse lactation consultant and the co-founder and executive director of Latched Support. And Dr. Patrick Ramsey is the director of UT Health San Antonio's Maternal-Fetal Medicine Fellowship training program, the director for maternal transport and outreach, and the maternal medical director for University Hospital's Level 4 Maternal Center. And Dr. Ramsey, we're going to get started. Can you tell me a little bit more about what you do and just give me an overview of the maternal health landscape here in Texas and why this is an important issue that we should all care about?
Sure. Thank you very much for having me as part of the panel today. In addition to my local roles at our institution, I have the privilege of serving the state of Texas on the Perinatal Advisory Council, the Maternal Mortality and Morbidity Committee, and as the Chief Medical Officer for the Texas Collaborative for Healthy Mothers and Babies. And through those roles, I think I've really got a good understanding of what's going on in Texas and where the opportunities are. Representative Minjarez highlighted the deficiencies we have in the state. Our rate of maternal mortality is the highest, among the highest in the country. And we know that for every woman that dies during pregnancy, 100 other women are affected by morbidity that may affect their long-term health. And those things affect not only mom, but they affect the whole family. Whether that baby is impacted or not, the whole family is impacted by that. And that impacts on our society as well. So I think we have a lot of work to do. Dr. Connery, one of the past presidents of the American College of Obstetrics and Gynecology, had a mantra, every woman, every visit, to highlight the fact that every provider in the state of Texas or in the country should address preconception care at every visit a woman comes into the healthcare process. And that's important because we know a lot of these conditions are there that could be addressed before pregnancy to optimize outcome. So where are we at in Texas? We do have a lot of great things going on. The Texas Mortality and Morbidity Committee is looking at why these deaths are occurring in Texas. In the last year, we've switched from reviewing the 2013-2014 cohorts to reviewing the contemporary cohort of 2019 to 2020. And that's giving us really important real-time information about why women are dying in Texas and how we can potentially implement interventions to reduce morbidity and mortality for women. The Texas Collaborative for Healthy Mothers and Babies is taking on important initiatives to reduce postpartum preeclampsia readmissions and complications therein. The Texas AIM initiative is a national organization that Texas has become part of to focus on dealing with hypertensive emergencies in women during pregnancy, as we know that that's one of the top two killers of women in Texas. The regional advisory councils, perinatal committees have formed an alliance called the RAC-PCR Alliance, and they are also working with the facilities at the boots on the ground level to make sure we can implement these quality improvement projects locally at the facilities to have the greatest impact for all the women of the state of Texas. So I think we have a lot of great things going on in Texas. Really proud to be part of it and glad that Molina Healthcare is taking this on as well. And thank you for allowing me to be part of the panel today.
Thank you so much. I'm going to go ahead and turn to Kori next. Kori, can you tell us a little bit more about the San Antonio Healthy Start program, what y'all do, and also the disparities within the community that you're hoping to address? Oh, Kori, you're on mute.
Is that better?
Yes, I can hear you now.
Sorry about that. Okay, so thank you. Yes, Healthy Start's been around in the community for a really long time. It's actually our 20-year anniversary this year. And although that's great that we've had resources in the community to help families and moms and babies, what that also means is that the statistics have been such that we qualify for that funding. In our case, our primary focus is on infant mortality. And that means that we've continued to have high rates of infant mortality in pockets of our community. Our current grant, we were able to qualify 12 zip codes in San Antonio due to the high infant mortality rates that exist there. And also things like low birth weight, premature birth, and maternal mortality and morbidities also factor into our qualifications. So we're glad to be here. Our mission is to strengthen families, empower neighborhoods, and improve health and community services so that all babies have an equal chance to live and thrive. And you can't have healthy babies without healthy moms. And so really our focus is on moms. We try to enroll women into our program the earliest in pregnancy as possible. We really try to get them in that first trimester. And Rep. Minjarez really, put an underscore on the statistics that exist in terms of our population accessing prenatal care. And the numbers are not great. The 2017 numbers that I was able to pull this week for the presentations show us that we still have only about 61% of women who are accessing prenatal care in that first trimester. And those numbers really are driven by our populations of color. Black moms are only accessing first trimester prenatal care at a rate of about 56%, and our Hispanic moms are just shortly behind that. So it's really very important that we prioritize women's health care throughout the life course to make sure that we have preventative care, that women are connected to services, that they have health insurance coverage, that they have adequate care, and that they know how to access it. We have a lot of resources in San Antonio, but a lot of times people are just not accessing them. Maybe they don't know about them, or maybe they are experiencing barriers that keep them from accessing those resources. And that's really one of the things that we try to do at Healthy Start: get women into their appointments, make sure they're keeping them, making sure that their children then go to their appointments once they're born, that they get postpartum care, that aftercare visit between 4 to 6 weeks, that they're getting care before and after pregnancy, that pregnancies are planned. All of these things are part of our performance measures with Healthy Start, and they really are critical to kind of evening out some of the disparities that exist, and working on underlying conditions that create those disparities. I talked about access. Those things can be transportation, they can be childcare, they can be income-based for not having the funding to pay for the co-pays that may be involved. They just may not be able to access their care because of fear of immigration or residency statuses. There's all kinds of things that go into those final numbers, and Healthy Start tries to help women and families overcome those barriers so that they can seek care. We also work with fathers. That's very important too, to make sure that we have all the folks that are working around a pregnancy to help support that pregnancy and to help moms get the care that they need so that they don't end up having morbidities that Dr. Ramsey mentioned. And really that access to care and getting good, consistent, and early care is a huge part of that.
Thank you so much. And yeah, all of y'all have touched on it, that we know that the social determinants of health, like income, access to transportation, housing, those have led to vast health disparities in our community. Natasha, I'm wondering if you can talk a little bit more about Catholic Charities, Family and Children's Services, and what y'all do to help connect families to resources like nursing home visits, housing support, education. And can you talk about what you see as the biggest challenges for our community and what the biggest needs are for your families?
Yes, absolutely. Good morning, everybody. And thank you for the opportunity to be present today and to share the perspective of a nonprofit. My name is Natasha Bridges, and I am the Senior Director of Family and Children's Services. And just a little history, Catholic Charities was established back in 1941. And the mission is really simple: to provide for the needs of the community through selfless service under the sign of love. I personally started out as a home visitor myself, utilizing the Parents as Teachers curriculum and working with pregnant teens and teen parents. And then I became a director overseeing a couple of programs working with more high needs families that were involved with Child Protective Services. And currently I am the program director of 2 programs and oversee all of Family and Children's Services. And our department consists of 4 evidence-based home visiting programs. And as mentioned, Nurse Family Partnership is one of those. NFP is a national model that provides a nurse home visitor to a first-time low-income mother who is less than 28 weeks in her gestation. So the goal of this program is really to help ensure healthy birth outcomes for mom and baby, and working towards self-sufficiency, goal setting, education. I'm really hoping helping her to return to school or find employment. We have 2 site-based programs that offer parenting education workshops as well, through school districts, community centers, shelters. And as Kori mentioned, we also have a dad's program. Super excited. It's our first kickoff this year. And it's really important to have that family unit. Even if the family isn't together, we work on co-parenting techniques as well. And our San Antonio birth doulas. Doulas are amazing. They offer such amount of education opportunities and support to families. And they are there to advocate for that laboring mother. Sometimes we have our young moms that don't know that they can ask questions or have a say in what their experiences is. And San Antonio Birth Doulas is there, and they're offering right now free pregnancy testing. And so we're really hoping to kind of help to identify those who are pregnant early. And then, as mentioned, if they do not have a medical home, we definitely try to get them connected to those resources right then and there. So really closing that window, hopefully to get access to care early. Childbirth and parenting education is important, no matter how old you are or how many kids you have. Each child is different. There's always something new to learn about child development and updated recommendations. What could have been true for our grandparents, this may not be necessarily true today. But though we know, parenting classes are just a part of building up a family's protective factors. If the household is hungry, they're not necessarily going to be paying attention about the lesson on healthy nutrition. They just want to eat when they can and what they can. So our team is very, very fortunate to work within Catholic Charities. We have a lot of wraparound services at our fingertips. Departments that include our seniors, refugees, Caritas legal services. And in our realm, we mostly utilize programs through our counseling department. Counseling is also offering wonderful domestic violence courses and anger management groups. And our housing services, as mentioned, we have our St. PJ's Children's Home, our Seton Home, and Seton Home is a residential facility for pregnant teens and teen parents. So really, they're on campus working with them intensively, providing them childcare so they can go to school and work towards goals. So when they do age out, they are ready to go. We also have Guadalupe Home. It's a cozy shelter. It's 11 rooms for homeless pregnant and parenting mothers. And case management is really heavy here, really providing, working on setting goals, hoping to reach that self-sufficiency level, work and stable housing when they leave Guadalupe Home. And we definitely utilize a lot of our family self-sufficiency services that are provided through St. Stephen's Care Center. That includes our food pantry and our clothing closet, as well as our Guadalupe Community Center for workforce development and emergency financial assistance. So presenting on Catholic Charities alone would not allow for other panelists to speak. So if you have more questions regarding the programs I oversee or other departments, definitely connect with me. I'd be more than happy to talk with you offline. And some of the barriers we're talking as a team, and this is a conversation we have quite often about accessing care. And some of our frontline staff have reported that sometimes there is kind of a been there, done that mentality. So maybe mom, this is her second or her third child, never really got formal prenatal care, maybe the first round or education. So the need to access care may be not on their radar. So majority of our clients report, yes, when they do go to the doctor, pretty routine. They're given opportunities to ask questions, but it's really hard for some of our moms to ask questions without a point of reference. So definitely encouraging more education and promoting our services to letting families know that, yes, we are available. As soon as you know you're pregnant, we are here for you. We had a mom or an educator had discussed with us a challenge with one of the moms who didn't have prenatal care probably till about her sixth month. And when she did, she reported, yes, that she was providing prenatal vitamins. And when the educator asked how that was going, she's like, oh, I haven't started them yet. I'm like, oh, you haven't started your vitamins yet. So working with the families, educating mom on the importance of things. Mom had no idea about the wonderful aspects of folic acid. And the next week when the educator went back, mom was quick to say, I've been taking my vitamins all week. So education, right? That's the big one. Other big barriers that do come up, as Kori mentioned, inability to take off work. There is a fear. Sometimes there is a fear to let their employer know that they are pregnant. And sometimes financially, they just can't afford to take off. So that is one of the challenges that is expressed, as well as little to no transportation to appointments. A lot of our families are unaware of medical transportation programs that are out there. So again, making families aware of this service, working on life skills to create those appointments early and being ready for that pickup time. And other challenges is the big one is that little to no childcare. Most of our moms, if they have siblings, the siblings aren't allowed in the waiting room or in the exam room. So if you don't have anyone to watch your kids, mom is going to stay home and she's not going to make it to her appointments. And I know also mentioning about postpartum care, that's another big one. Again, if little to no transportation, if mom utilizes one of those medical transportation services, if there's siblings, the siblings can't go in the vehicle because it's not for their appointment. Or if mom was released from the hospital using a borrowed car seat and she doesn't have one herself, she can't utilize that transportation service either if baby doesn't have a car seat. So those are some of the big ones that do come up quite often for challenges for our families.
Thank you so much, Natasha. Ashley, I'm going to shift to you. You started Latched Support after working in the medical system yourself, where you witnessed some of these racial disparities firsthand. I'm wondering, can you tell me a little bit more about that and why you helped found Latched Support? And can you talk about how y'all are working to address disparities and what you think other organizations can do to help address those disparities?
Absolutely. Again, thank you for having us today. You know, I think listening to everyone, we have a little bit of a different perspective and especially a different start to our nonprofit. As you all know, I am the co-founder, so there's another half of me, but she and I are both registered nurse lactation consultants, and we did meet while working in a hospital setting. We got to see the behind the scenes as labor and delivery nurses and postpartum nurses and lactation consultants, where our moms were actually afraid to go home. They would come in with very little education. They would oftentimes say, I wish I could take you home with me. And then also from our fellow colleagues, unfortunately, from other nurses and lactation consultants, we would hear ugly comments behind the scenes about moms that they were caring for or wouldn't want to care for. Comments such as, oh, that mom is Black, she's probably not going to breastfeed. Oh, that mom's a teen mom, she's probably not going to breastfeed. So she'd either end up at the bottom of the list or not seen at all. So we wanted to really start a nonprofit organization that cared for families from regardless of their race, socioeconomic status, and ethnicity. And we wanted to offer our services for free. So we started off back before COVID, of course, entering into our mom's home, helping them breastfeed. However, when we entered into the homes to help them breastfeed, we would see, oh, wow, why are they not breastfeeding? They have so many different stressors going on. Let's figure out a way to understand and help them with these, and then breastfeeding can fall into place as well. You know, so from there, we've seen that over the last, we're just celebrating our 4-year anniversary actually this month. And over the last 4 years, we've opened 2 locations and we've had great success. We serve over 1,000 families a month between the 2 locations. And we've had great success because we remain having an approach of a grassroots approach. And also because we are relatable and we look like the clients in which we serve. So we really get to know our families, get to know what's going on, what are they dealing with, and then we help them and build them from there. We're able to build that trust and that bond with our families so they'll allow us to follow them. We've also been able to offer our breastfeeding equity trainings to other organizations within the city, and this has allowed an open discussion for other individuals that are doing the work of how the care for women of color is happening. I think for other organizations, what we would really recommend is taking a look at the services they offer in a diversity lens, and also taking a look at equity in a real life approach and for each individual client that they serve.
Thank you so much, Ashley. Kori, I'm going to get back to you. Everyone has talked a lot about these disparities. Can you talk about what changes, if any, we're seeing on the local level to address these issues, and what changes you'd like to see here in San Antonio?
Sure. Well, I think the pandemic has really put a spotlight on disparities, and even before the pandemic really ramped up. I know at Metro Health, health equity really became a priority for us. I know it was written into our Healthy Start grant to look at everything through a trauma-informed and equity perspective, and nothing that we do is cookie cutter. Everything is definitely tailored towards the needs of the individual family and meeting them where they are. And I think that's really critical, is to make sure that, you know, you practice active listening, that you make sure that you're not imposing things on people, that you do meet them more than halfway where they are, so that we can get people the resources they need to create that equity. And equality is not going to cut it. We need to make sure that we're funneling resources where they need to go so that we can make things equitable. I know we've been doing a lot of education around equity. I think that's really important. I think some people, or a lot of people, have an idea of what they think disparities are, what they think equity is. And they may be a little bit off the mark, especially if you're talking about systems change and how to implement trauma-informed practices and equity practices in an organizational or a systems level, because there really are a lot of moving parts that you have to touch to make sure that you're doing that properly, and that the community voice and community engagement and lived experience have a place in whatever is implemented. And it has to be all the way from, the top down and down up and across, to make sure that changes are implemented. I know at Metro Health, we've prioritized equity. We now have an Office of Health Equity that works with the larger Office of Equity at the city. And we've expanded just operationally a lot of things to support some of the underpinnings that create inequities. For instance, we've greatly expanded our violence prevention section. It's really hard to focus on equity when we have unresolved violence and systemic racism in our communities, and our very large expansion in that area is really helpful to looking at some of the underlying factors and core issues that create some of the circumstances that have been existent for a long time and that are still being perpetuated. And that's really important, having difficult conversations and introspection, and really calling out the things that we see. Our trauma-informed consortium is another big part of that. Our prioritization of access to care and all the things that go into that. A prioritization on mental health is also really important. We see mental health as the basis for a lot of inequities, a lot of barriers in our community accessing maternal care and family care and preventative wellness. All of those things are really critical. One of the things that we've done operationally to prioritize maternal child health is that we actually have a division that was just created for maternal child health. We had a bunch of programs that were dealing with women and children and those types of issues, but we didn't have that as a section. And now we do have a section for maternal child health, which is great. We have some leadership behind that, and we have ways to create synergies across programs like WIC and oral health and our Project Worth, which is our teen pregnancy prevention program, and work together, and also with other programs within the city and external partners, and really looking at kind of our coalition work that all of us do. Healthy Start has the Healthy Families Network, which is partners working in maternal child health and really trying to create systemic change. And I know the March of Dimes has a new collective impact grant that's now in the community, specifically focusing on not only preterm birth, which is kind of their usual wheelhouse, but also maternal mortality and morbidity. So I think we're seeing a lot of focus on some of these existing issues that have been here for a while, but have gotten a spotlight because of the pandemic. And so what I'd like to see is really that we maintain maintain that focus on having that holistic view of how the community addresses women and children and families and health, and how we can prioritize those health issues and not let down on it, and make sure that we keep that focus up, that we keep the resources flowing, that we keep the collaborations going, and that we work together really to address some of the core issues that lead to these inequities in our communities.
Thank you so much. And gosh, yeah, speaking of the pandemic, here we are 18 months in, still on Zoom. Dr. Ramsey, can you talk a little bit more about what we've learned over the last 18 months and what you think the short and long-term changes are going to be in the maternal health landscape just because of the pandemic?
Sure. Thank you for that great question. Yeah, we've learned a lot in the last year. I think one of our early challenges was just the lack of knowledge. What does this mean? What is the impact for mom and baby, for pregnancy and the newborn? And some of the short-term impact has been just developing those processes to make sure that mom and baby can remain together. As you may be aware, or you recall, there were a lot of stories in the media last March, March of 2020, where hospitals were separating moms and babies, and that was not good for the family unit, for bonding. And quickly, the healthcare systems adapted to we learned that babies weren't as high of risk for COVID, and learned that separation was not helpful at all and harmful potentially. So I think one of the short-term impacts was developing approaches to maintain safety for mom, baby, family, and the providers while contact with mom and family to stay together. So that was, I think, a lesson learned that we'll never regret that experience, just because we've learned what we need to do for the future. We learned that having appropriate PPE, personal protective equipment, is super important. Fortunately, I think, for better or worse, the Ebola scare several years ago allowed hospitals to start to think about infectious disease preparedness. I don't think that was really on the spectrum well. H1N1 was an event that happened over a decade ago, but really flu is flu. But Ebola was scary, right? And COVID was unknown, so it was equally as scary. We didn't know what it meant. So I think having the adequate preparations for facilities to have the right protective equipment for them and families, as well as preparedness for the surge. We had a surge of patients coming in. Many were asymptomatic. And how do you maintain that protection for the providers and the families, knowing that a lot of these people coming in may have the infection, but we don't know it. And that was scary at the beginning, and still is today. We have a lot of women coming in asymptomatic. The Delta variant has also added more concerns, because it looks like pregnant women are more affected by the Delta variant. And over the last 2 months, we've seen a huge surge of pregnant women being admitted for serious respiratory difficulty, intensive care unit admissions. And we know that COVID now, today we know that COVID affects pregnant women worse than the non-pregnant population. I think some of the long-term impact of the pandemic will be just that preparedness. We're going to be prepared for the surge of patients that may come in. We learned that we can do things differently. Telemedicine, virtual meetings like this. We all talked about it before. A few people did it well. It wasn't funded before. But we quickly adapted through the state and through facilities to implement telemedicine to increase access to patients who may have been fearful to come to the hospital, or maybe couldn't get to the hospital because the hospital beds were full of COVID patients. So using telemedicine, it really pushed us off the ledge to learn how to use telemedicine effectively. And I think going forward, that has to be something that is continuing to provide support for funding for telemedicine, because it's a very efficient approach to care, increases access, and overall provides better care for patients. The other thing I think we've learned going forward, that it's important to have unified messaging. It came out very early that the CDC was our voice with the American College of Obstetricians and Gynecologists, American Academy of Pediatrics, to have that unified voice of here's what we think is the best knowledge of this disease process. I think we've seen in the past different entities would come out with different statements. And I think everybody was pausing with COVID because we just didn't know. And the information was coming out so rapid fire that we really fell back to the national organizations to provide that guidance for what the best practices are. So I think that unified messaging is really important. And last, the long-term lesson learned, I think, is advocating for women. You may recall the World Health Organization excluded pregnant women from getting the COVID vaccine in their recommendations early on. There was some hesitation to consider the birth experience as an aerosolizing event for healthcare providers to have access to personal protective equipment, and really great advocacy by the national organizations and leaders in the state to push the envelope to say, no, pregnant women are eligible for the vaccine. They are at risk. We're putting mom and baby at risk. And really some very strong statements came out in advocating that women get access to the vaccine. And now we know today that over 100,000 women have received the COVID vaccines. It is safe. There's no harm to mom or baby. And it is FDA approved for the Pfizer vaccine at this point. So just getting over that vaccine hesitancy and that fake news is certainly something we need to push the envelope further on. So thank you for that question.
Thanks so much. And one other thing, the pandemic has definitely shown kind of how far we still have to go in having healthcare that is representative of the communities that we've lived in, especially when it comes to race and ethnicity. Ashley, given your experience both working in the medical system and at Latched Support, can you talk a little bit about why having a representative healthcare workforce is so important, and just why diversity is important to care for moms and babies?
Absolutely. I mean, diversity among healthcare providers is extremely important. I think we should be meeting the needs, the progressive needs of our community in terms of race and ethnicity. And so our healthcare providers should reflect the community that we serve. You know, the more that a mom or a family is understood and represented, the better that we can care for them. We see that they're going to open up more, they're going to engage more, and they'll allow us to meet them where they're at because they're more comfortable.
And Dr. Ramsey, can you talk a little bit about what we can do to help further recruitment, training, and hiring efforts to have a more reflective healthcare workforce?
Sure, great. So Texas is huge, right? Our delivery volume in the state of Texas accounts for 10% of the deliveries in the United States. We have more diversity in our state than most of the states in the United States. So we have the people here in the state. I think part of it's getting information out, making sure people are aware of opportunities that are available for getting involved in these improvement efforts for women. Incentivizing, I think we've seen that there's a shortage of nurses currently in the United States and in Texas. There's going to be an OB/GYN shortage in the state, in the country in the next decade. And we really need to start developing incentive plans that are tailored to address those disparities and make sure people get involved with those areas where we're going to have huge deficiencies for care. I think it's so important to have that diversity, because hearing that voice from an underrepresented group may give us a different viewpoint on things, and may open our eyes to a different opportunity or a different approach to care, being culturally sensitive, addressing the language barriers. We, in a given day in our clinics, we probably use interpreter lines for 10 to 15 different languages, not only Spanish, but it's Pashki and all these other languages. We just need to be more diverse in our workforce. I think a lot of effort needs to be put into that area, and some dollars need to go behind it as well.
Thanks so much. Yeah, that's such an important issue. Natasha, looking at Catholic Charities of San Antonio, y'all help provide some of those gaps kind of before folks enter the healthcare sphere. You serve over 55,000 families every year, or people every year. Can you talk about your experience overseeing Catholic Charities programs and just kind of how the pandemic has changed things for families and what we need to do better to support them?
Yes, absolutely. Thank you. So our agency definitely responded quickly. We continued working day one. We definitely started putting working from home policies in place. For those who worked out in the field, technology checks, updates to our video conferencing platforms, webcams, like a lot of things that we didn't have before. So I was definitely proud of our team. They were able to pivot from in-person services in less than like a month. So we had to revisit a lot of ground rules when teaching virtually, leaving the camera on and muting and unmuting. And for those of you who are parents who had virtual learners this past couple of years, you know exactly what I'm talking about. So becoming creative in presentation styles, including video snippets and games. Some of our home visiting programs were able to use some grant funding to purchase things like tripods to help, with their cell phone and their tablet. So this way they're still hands-free, still can be with baby, or still work on those hands-on activities, such as making a soother sock and things of that nature. So even though we transitioned to virtual services for our education classes and our individual home visiting, we're still providing basic needs assistance. So our educators would schedule curbside drop-offs for educational materials, hygiene products, food, diapers, things of that nature. And we are now currently operating in a hybrid approach where virtual and in-home visiting is still occurring. We are following CDC guidelines, pre-screening questions, temperature checks. And then if weather permits, we are visiting outdoors with our families. We are getting definitely more families, as Dr. Ramsey discussed earlier. We're definitely getting more families letting us know that there is increasing positivity rates for COVID within the whole family. And sometimes we have multi-generational households. So mom is getting sick and baby and dad. And a lot of our pregnant moms have been open since day one of that natural fear that they have of getting the vaccine, because not knowing of what the effects will be on them and on their baby. So again, as mentioned, a lot of misinformation, and we try to do our best, with that information that we're given by Metro Health and CDC, to really let them know that, it is safe and for the better well-being of yourself and for babies. So those are the things we are definitely working on during this time. And then how it's really impacted us, and this was also mentioned as well, a lot of the common challenges that our families are expressing normally is always trying to increase their social network and their concrete supports. But this pandemic really brought on additional instances of isolation. So all of our programs do pre-screen for postpartum depression within the 3rd trimester or up to 1 year postpartum. But we are always in need of more maternal mental health services and resources. We recently partnered with Voices for Children, and we are offering the ROSE curriculum for prenatal women, Reach Out, Stay Strong Essentials. And this is a group-based program that's going to educate moms on postpartum depression, managing stress in their transition into motherhood, and connecting to relevant postpartum resources. But definitely maternal mental health is needed.
Thanks so much. And Chris, I'm going to bring this back to you. I want you to talk a little bit more about the work that Molina Healthcare of Texas is doing, especially when it comes to managed care and improving outcomes for families.
Yeah, thanks, Marina. I think it was Kori that mentioned earlier how there really is no cookie cutter approach to meeting the needs of many of these pregnant mothers and new mothers. And, we certainly as a managed care organization understand that, it really takes a partnership. It really takes the outreach and wraparound, working with community organizations such as many on this panel to really help focus on providing those support resources to help women and new mothers holistically. We have a whole team of case managers and service coordinators, and they do fabulous work, but it certainly takes the partnership with the community organizations to really meet the individual needs of many of these members. Molina has several programs to help mothers and moms to be with their pregnancies and helping to secure healthy pregnancies and healthy babies. A couple of programs in particular that come to mind is the Molina Healthy Moms and Healthy Babies program, and another program that we have called Healthy Beginnings. The Healthy Moms and Healthy Babies program really provides a holistic case management service to women whose pregnancy is considered to be more of a low to moderate risk, and offers support through health education, psychoeducation, and really helping the member to better understand and connect them with the benefits and the community resources out there. The other program, the Healthy Beginnings, is focused a little more on the higher risk cases. This program uses more of a collaborative team approach for risk screening, clinical case management, and of course, education. That program promotes early and regular prenatal care and postpartum follow-up, and emphasizes the importance of a healthy diet, dental care, drug and alcohol abstinence, and communication with practitioners. But it really is a partnership with community organizations to meet the individual needs.
Thanks so much. And I've got one last question for all of our panelists. We've talked a lot about where we've been and where we're hoping to go with maternal health in Texas. And we know that Texas is growing, especially by populations of folks of color. And we are going to need to develop solutions to ensure that we have equity in care for moms and babies. You each represent a different sector of the healthcare system for moms and babies. Can you talk about, from your experience, kind of what solutions and programs you would like to see implemented in the future to help this? And Dr. Patrick Ramsey, I'll put you on the spot first.
All right, fair enough. I think two areas from the healthcare provider side. First is we learned telemedicine can work. We can reach those rural areas of Texas. We need to embrace that. We need legislation to keep that funding for telemedicine sustainable after the pandemic. We need to have healthcare plans embrace support for practices that engage telemedicine. I think that's so important because we can have a much greater reach to providers to patients around the state if we have access to telemedicine. So I think that would be the first program I would suggest widespread throughout Texas and entities. And second is we need data. We currently rely on administrative data that lags for 9 to 12 months, but we really need more real-time data on maternal and perinatal health outcomes to inform us for what activities we're doing now, how they're impacting care a month from now, not a year from now. So that lag in care is really problematic. So we've been advocating through the Texas Collaborative for Healthy Mothers and Babies and other organizations in the state to develop a state level data set for perinatal outcomes, including maternal outcomes. So I think those would be the two big areas I would focus on.
Thanks so much. Ashley, what do you think?
One big thing really for us, what we've seen is we still see so many families going into the hospitals uneducated as far as with lacking the education for prenatal care, but also lacking the education for postpartum care. How do I take care of my postpartum body? And also how do I take care of my newborn? We talk to so many nurses within the different hospitals and they're really just begging us, please meet them early on in the pregnancy and prepare them for the hospital because the nurses get to see them for only 2 to 3 days maybe, and they're nervous to discharge them home because it is a safety risk because they don't know how to care for themselves nor that child. So we really have seen, of course, our success rates here at Latched. The earlier in the pregnancy we're able to get that mom, the more education we can pour into her, the more she will attend those prenatal and postpartum visits as well. And she knows how to care for her child. But we really would love to see more of a collaboration with our hospitals and with our different OBGYNs, collaborating with other nonprofit organizations within the city that are offering this pregnancy education. That way we can see a difference with our moms that as they come into the pregnancy and also postpartum, they'll have healthier outcomes because we know that an educated pregnancy leads to a healthier pregnancy.
Thanks so much. Kori, what do you think we can do to work together better?
I would echo some of those same sentiments shared by Dr. Ramsey and Ashley. I think we need to focus on both health literacy of the consumers, making sure that they are empowered and being able to have conversations with their providers and that they feel comfortable to do so. And the flip side of that is that kind of cultural competency that providers can have so that they are open to hearing feedback and they are open to providing education and services in the way that clients say that they need them. And then definitely that data access issue that Dr. Ramsey mentioned, it's really difficult when data is sometimes several years behind, and trying to make decisions in real time that are going to affect problems now is difficult when that data is so far behind. So some transparency, I think in creating kind of local data agendas and some sharing would really go a long way timely to providing information, that we could act in more concurrent timeframes to create solutions for our communities.
Thanks so much. Natasha, what would you like us to know about this?
Yes, ma'am. So one of the programs I didn't mention was our Family Connects programs, and it is a nursing home visiting program as well. And because of capacity, we are only limited to receive clients from Children's Hospital of San Antonio. So postpartum, families are provided information about the program. On the delivery postpartum floor, they're provided the information about the program, and then postpartum, a nurse will go to their home and visit with them once or twice within a couple of weeks, and definitely getting them connected again to those education and resources. So really do enjoy that program out of here in that partnership with Children's Hospital of San Antonio. Definitely overall, as definitely everyone has mentioned, I do echo those sentiments. Discussions such as these with multiple perspectives are great. We learn from one another, we can share resources. Definitely like to hear a little bit more from our clientele personally. Would love to have our clients represented and hear their voice, maybe even through surveys and focus groups, things like that. And I would also like to take this opportunity to plug a coalition that we are a part of, considering we're talking about collaborations. Ready Kid SA is a coalition of organizations and partners across Bexar County that builds on successful child and family programs in San Antonio with the vision of growing happy and healthy, ready children. The goals of the coalition are to connect families prenatally and with children 0 to 8 in Bexar County, and to ensure that children are on track to reach their milestones and in their social, emotional, and physical cognitive development. Ready Kid SA was created because research does show early investments in children's will benefit them now and will also benefit as they grow and transition to becoming healthy and thriving, contributing adults. And to that end, our KSA developed Bexar County's Children's Agenda to promote the track alignment of our community investments in children. The United Way and the City of San Antonio currently both invest in several elements of this agenda. So we have community partners all over, Catholic Charities, Family Service Association, CASA, Department of Family Protective Services. So we all get together, but one of the things we are missing at the table are more medical representation. So OBGYNs, pediatricians. So if you or you know someone who may be interested in joining our group, we would love to hear from you, and I can get you connected.
Well, thank you so much, everyone. I know I learned a ton. I'm sure everyone else did too. Thank you again for being here, and I'm going to turn it over to Chris for closing remarks.
Yeah, no, thank you to all. Thank you to our panelists. It was a great conversation. I took a number of notes as well to maybe some post panel discussions, but thank you certainly to our panelists. Thank you, Marina, for moderating such an important discussion. And certainly thank you to all of our attendees for joining today's discussion. I guess just to close, I would just say to anyone out there who's attending or listening, if you're interested to learn more about some of the work that Molina is doing here in our community, I just encourage you to visit MolinaCares.com to get a good understanding as to all that we're doing. I just want to again thank everyone for participating. And Marina, with that, that's all I have.
Okay.
So
yeah, thanks everyone.
Thank you everyone for joining.